Sassy, moody, nasty. I am a savage.
I need help. I got shot.
Can you guys help? What's your name?
Alex.
Okay, Alex, let me take a look.
This fucking hurts.
Oh, I know. All right.
Ah.
I have an abdominal GSW in the ambulance bay. Code trauma now.
This is not uncommon. When I was a resident, we would have numerous people drive up just like this. Van, it's a car. They would literally roll the body out of the vehicle. And this is someone that was shot, stabbed. They could have been assaulted somehow. They were literally dropped off, and then the vehicle would just drive away. And the reason they drive away is because they don't want to stick around for questions. So as physicians, as nurses, as ER techs, everybody is kind of going out there, bringing that patient in, and we're going to start treating that patient immediately to try to save their life.
GSW just got dumped by Homeboy ambulance.
Okay, you got this?
Yeah, go.
2 grams of Ansep, ortho's on their way.
Systolics only 80, 14 gauge, left AC.
We got 2 units of whole blood going on the rapid infuser.
Call the OR, we'll be right up.
Lungs up.
You take medications every day. Any allergies?
No.
So here the patient's blood pressure is 80 systolic after suffering a gunshot wound to the abdomen. A lot of things are happening in a short period of time. Again, we're making sure airway's intact. We're checking on breath sounds. We're looking at circulation. In this case, we have bilateral 14 gauge IVs going in. We're starting fluids. We're starting blood. Some patients, we're actually going to put a trauma cortis in and start giving blood right away. So again, cardiac monitor. If this patient is unstable, they're going directly to the operating room and to get opened up, what we call an exploratory laparotomy. If they are stable, sometimes they go to CAT scan first to help delineate some of the injuries prior to OR. But either way, this patient's going to the OR.
Morrison's in full blood. See that?
Yeah. Tore up his liver.
So here the resident did a fast exam indicating free fluid within the abdomen. Now, it's still important to do a fast exam with really any gunshot wound to the abdomen. Again, it doesn't matter if it's to the chest, it's to the abdomen, you still do a fast exam. Realize I've also had a patient before that suffered a gunshot wound to the right upper quadrant. Fast was negative. And it turns out the bullet actually traversed superiorly, and the patient actually had a hemopneumothorax, so it actually angled up, and they had significant chest trauma. So again, it's best just to do a fast on all trauma patients.
What's his name?
Alex.
Alex, you've lost a lot of blood. You need to go to surgery right away. We're gonna die.
Not now that I'm here.
Spoken with humility and with surgery. Boys ready. How's he doing?
So this is the humility of the ER. So just like Grey's Anatomy, when Dr. McDreamy says, it's a beautiful day to save lives, every now and then some of my colleagues will actually hear me say, when we're actually going to be getting a patient come in, it's going to be a resuscitation, they'll actually hear me say in the trauma bay or wherever it's at, hey everybody, this is a beautiful day to save lives. Let's make it happen. And so I get where they're coming from with this, and I love it.
He's coming up a bit.
Let's go.
You call my mom? She's the ice on my step.
Of course.